Hello, and welcome to the Champlain Fall Prevention Education module for regulated health professionals. My name is Christine Bidmead, and I was part of the team that created and led the Champlain Stay on Your Feet Fall Prevention Strategy. This module is part of our education framework, which covers education for older adults and their families, a module for healthcare workers such as PSWs, volunteers, etc., this one for health professionals, and then there are two advanced ones for people who work in geriatrics or advanced practitioners such as GPs or nurse practitioners, etc. And the final one being a certified session for physicians and others through Ottawa University. All can be found on www.stopfalls.ca, which is the website that holds all the documents and resources that will be discussed in this session. If you have any questions, please email rgpeo@toh.ca, and we will do our best to get you the answers you need. This information will also be on the final slide. So this is an outline of the module, giving you an overview of fall prevention using the Champlain tools that can be found on our website, including the very important aspect of having the conversation with older people and their families about falls. I would just like to thank the members of the Education Working Group of the Champlain Fall Prevention Steering Committee, who all contributed to this module. The Home and Community Care Learning module formed the basis of the presentation, and we had contributions from the Regional Geriatric Programme of Eastern Ontario, Ottawa Public Health, Eastern Ontario Health Unit, Renfrew County and District Public Health, and Heartwise. After this session, you should feel more confident about fall prevention and your role in screening and assessing, intervening and referring in terms of falls. You should also feel able to use the Champlain resources that are available on our website and to be able to use this knowledge to support and educate your patients and their families and caregivers. First of all, we need to confirm the definition used across Champlain and in fact by the Ontario Fall Prevention Collaborative, which is the WHO definition. A fall is an event which results in a person coming to rest inadvertently on the ground or floor or other lower level with or without injury. And then a near fall is when a potential fall is averted through purposeful actions. Many people assume that as you get older, you will fall more. That is not true. The risk is that you will injure yourself more because of other pre-existing underlying conditions. A fall or near fall can be a sign of some issue that can be addressed if that fall is recognized and reported. Every older adult should be asked at least annually if they have fallen in the past 6 months. So when you assess an older adult, always screen for falls by asking the question, have you fallen or almost fallen in the past 6 months? Observe their gait and balance, and if possible, ask them to complete the Staying Independent checklist. Remember, a near fall can be a red flag that if appropriate assessment is done, a fall with injury can be averted. Why do falls matter? A fall impacts an individual's quality of life due to injury, disability, and fear of falling, and potential loss of independence. As a person loses confidence, they restrict their activity, lose mobility, and independence decreases. A near fall can be a warning sign and a time to be proactive to stay independent. This cycle of losing confidence and then doing less because of a fear of falling actually increases the risk of falling and loss of independence. This in turn has an effect on the individual's caregivers and family members as they step in to support. Caregivers and family can help with reinforcing the right messaging to help change the vicious cycle of post-fall syndrome. We know from the research that most falls can be prevented. So what do these stats show us? Here are some numbers that make you think. 85% of seniors' admissions to hospital for injuries are because of falls. Injuries due to falls rose by 43% between 2003 and 2008 in 5 years. The average senior spends 10 days longer in hospital for a fall-related admission than for any other cause. Think of the impact of that on our hospital capacity and hallway medicine. 50% of falls needing hospitalization happen at home. Here is some Ontario data. Fall-related injuries among older adults in Ontario caused over 250,000 emergency room visits in 2014 and 15, and over 60,000 hospitalizations in 2014-15. Over $2 billion in direct healthcare costs were related to falls in 2010. Fall-related injuries among older adults can be prevented through a range of effective strategies. A 20% reduction in fall-related injuries among older adults could save the Ontario government $400 million each year. More stats again. In Canada, 4 out of 5 injury-related hospital admissions in older adults were due to falls. In the USA, an older adult is treated in the emergency department for a fall every 11 seconds. Every 19 minutes in the USA, an older adult dies from a fall. 1 in 4 older adult falls each year. 29 million falls and 7 million injuries a year. Anyone can fall, but as we age, the risks increase. The risk of injury increases as well. Approximately 1 person out of 3 who's 65 years and older falls every year, and that number increases to 1 out of 2 for older adults over 80. After 1 fall, an older adult is twice as likely to fall again. Women are 3 times more likely to be hospitalized for an injury associated with a fall, but men are more likely than women to suffer a fatal fall. Maybe this is because men take more risks. Ladders spring to mind. And interestingly, the WHO report on falls, which was released this summer, had a whole section on ladders. It is important to remember that falls are not an important part of aging. These 2 factors form an important part of an initial screen for falls. Screening and assessment. These should not be confused with each other. A screen is not an assessment. A screen is that type of initial review of the possibility of a specific issue with a quick yes or no answer type of process. An assessment is the detailed process of defining the issue, finding the root cause, diagnosing and determining the appropriate intervention, treatment, etc. So asking your client if they have fallen in the past year, if they have mobility or gait issues, or if they score 4 or more in the Staying Independent checklist, then you could identify that further assessment is required. This is the Staying Independent checklist and is the screening tool recommended by the Champlain Fall Prevention Steering Committee for use in the community and in primary care. It is validated for use with community-dwelling older adults, so is not appropriate for screening in long-term care or for people who are in a hospital inpatient setting. It was developed in 2011 in Los Angeles by Rubenstein et al. And has been adapted with their permission. This screen is best carried out by the older adult themselves, maybe with their families or caregivers' support, and then if they score 4 or more, they should visit their primary care provider for a more detailed assessment, as per the Champlain Fall Prevention algorithm. If you can encourage all your older adult clients to complete this tool and follow up on issues with primary care, we could see a decline in falls with injury and all that those falls incur. The tool covers falls, loss of confidence and fear of falling, balance concerns, when a walking aid might be beneficial, incontinence, neuropathy, as in numbness of the feet, medications that make a person drowsy, and depression. When we tested this as a potential tool for use in primary care in 2013, we trialled it with 5 primary care clinics, which were CHCs, a solo GP, family health teams, etc. And the GPs in some clinics actually went through this with their patients and found out so much more about them. In that trial, we learned that this had to be part of an EMR or it would not be useful. And also 35% of the patients screened needed further assessment, which fits nicely with the research evidence. You can find this tool on the Stop Falls website, and I encourage you to use it, share it, and follow up with your clients with it. If nothing else, it starts the conversation in a safe way, and you can have a positive approach to talking about increased activity and exercise, nutrition, etc. There are a lot of supportive documents and booklets that can also be found on public health sites, as well as on the Stop Falls website. Screening should be done annually with at least a question of have you fallen in the past year or the staying independent checklist being completed. It should also be done after a fall, after a significant change in health, or admission to a new service. As I said earlier, this can help an older person to understand and feel that they can monitor their own falls risk. They can talk it through with family and friends, and they can feel a sense of control. If they score 4 or more points on the Staying Independent checklist, they could discuss it with you and their primary care physician's practice about next steps, which we will review with the Champlain Fall Prevention algorithm. For those who've scored less than 4 and have not fallen in the past 6 months, then the following public health messages should be reinforced. Give them the You Can Prevent Falls brochure from Public Health. This is a very useful pamphlet and has good home safety review in it. Follow the public health guidelines on nutrition, bone health, etc. Maintain or introduce exercise, yearly vision and hearing checks, and watching the seniors education modules on www.stopfalls.ca. The Champlain Fall Prevention algorithm. As I said, it was developed in 2013 and trialed with 5 practices and has been incorporated into the Putting the Brakes on Breaks electronic medical record for primary care on the Practice Solutions platform. It was reviewed in 2018 and is based on the American Geriatric Society and British Geriatric Society guidelines, as well as the RNAO best practice guidelines, and then adapted for use in Champlain. You will see that the colouring of the algorithm goes from green through yellow, amber to red. Green is for the actively aging healthy adults in the community who may be able to answer no to these questions. As they become more at risk, a more detailed assessment and secondary prevention approach should be taking place, with a referral on to specialised geriatric services as they become more complex, such as with cognitive decline. The Champlain Stay on Your Feet model reflects this colour coding as well, and that can be found on our website. The algorithm starts with screening, a quick review to see if there's an issue which needs further assessment. This is the first green circle in the top left side. The screening consists of 2 or more falls in the past 12 months, a fall with injury, difficulty walking or with balance, or a score of 4 or more with a Staying Independent checklist. Now we're going to go to the second elongated circle on the left side. If they answer no to all of the screening questions, then give them the public health promotion information, the You Can Prevent Falls pamphlet, and the Staying Independent checklist, and encourage exercise and physical activity. If the older adult is a yes to any of the screening questions, then you proceed down to the next circle. You obtain a history of their fall and the falls, how, when, or where it happened, and review their gait and balance if you can. Just observing them getting out of a chair and walking across the room without knowing they're being watched is very useful. Do you feel that they're likely to fall again, given these factors? Have they had a single fall in the past year or several? Yes or no? If no, continue to the public health messaging, but if yes, a further gait assessment should be done, a timed up and go or tug, or the chair stand test, depending on space, etc. If there are no concerns with this, then public health messaging, but if yes, they should be seen by the primary care team for a more in-depth assessment, and we'll continue with this part later. It is important that we all sing from the same song sheet, and that the older adults hear the same messages from everyone. These are public health promotion messages for healthy aging and fall prevention, and should be introduced and reinforced at every stage of your intervention with the older adults. We're talking about encouraging regular health visits, completing the home safety checkup, 150 minutes of physical activity, muscle and bone strengthening exercises to improve balance, eating 3 or more servings of calcium-rich foods a day, and taking a vitamin D supplement. So now we have a client who has fallen, who answers yes to the questions, have you fallen or had several falls in the past year? A review of their gait should be done, and we recommend the timed up and go or the chair stand test. These tests do not need to be done by a physiotherapist, However, when a physio does this test, they're looking at much more than the time taken. They're assessing the evenness of gait, looking for any weakness, balance issues, compensation in the back, and what interventions that they can put forward. But a tug can help determine and screen the person's risk of a fall. The timed up and go. You need space to do a tug, as you will be asking the person to get up from a chair, walk 10 feet, turn and walk back to the chair and sit down again, and you'll be timing them. All of the information about these tests is on our website, and I would recommend that you watch the video as well. Research shows that a tug score of 10 seconds or less is the score for a healthy individual aged 60 to 80. If an older adult has a score of 13.5 seconds or more, they need to go for further assessment. 14 seconds is a good cutoff point to consider, allowing for inaccurate stopwatches, etc. The tug score for risk of falls is not valid with cognitive impairment, and persons with cognitive impairment and falls, termed forgetful fallers, likely need a referral to specialised geriatrics. If space is an issue in someone's home or in an office, the chair stand test is a count of how many sit to stand to sit again moves a person can do in 30 seconds. This test is ideal for a small space, such as an office room or in a patient's home. The equipment required is simple: a chair with a straight back without armrests, seat 17 inches high or thereabouts, and a stopwatch, and you can use a smartphone. You measure the number of stands that a person can do in 30 seconds. From the table above, you can see that the number goes down with age, so you can tell if your client is in need of further assessment to find out why they have weaker legs and reduced endurance. Probably there's some underlying issue that could be investigated and intervened, treated, and maybe some deconditioning as well. Again, instructions and a video are on our website for both these tests. There are so many risks of falls to consider. Some are intrinsic and some extrinsic, and all should be taken into account when you assess, so that you can provide interventions within your scope of practice and refer on for further assessment to the appropriate professional, etc. Intrinsic factors. Increased age, as we know, increases the risk of injury, and being female can mean more falls. But men have more serious injuries and more fatal falls. A previous fall is a big red flag. Mobility issues and recent changes in mobility should be taken into consideration. Postural hypotension, understanding that and making sure your client knows what they can do to mitigate that dizziness when getting up from the bed or chair. Pain on movement will mean less ability or willingness to move, so good pain control is very important. Behavior disorders, especially cognition, need the right approach and assessment and referral. Decreased vision, hearing, and neuropathy can affect balance and gait. Extrinsic factors obviously include polypharmacy, and a medication review is a key part of a falls assessment. Alcohol use and cannabis use need to be discussed. A home environmental checklist helps review safety in the home, and a discussion about taking risks such as ladders. Not concentrating on stairs or slippery surfaces, not using walking aids, poor lighting, poorly fitting shoes, etc. So now we have identified that this person needs further assessment, and we will discuss this assessment in more detail. When a team approaches best, and a team of healthcare professionals communicate and share their findings to build a whole picture of the client's status and needs. Other risk factors that compound the risk of falls are comorbidities and chronic disease, vision and hearing loss, impaired cognition that can lead to wandering or impulsive behaviors, and these are best handled with the involvement of the specialized geriatric team. Impaired cognition can be a side effect of a medication or from depression, maybe a result of dementia, but can also be caused by a delirium from an underlying infection such as a urinary tract infection. This in itself, a UTI, can cause urgency and incontinent, which can mean a rush to the bathroom, which may mean going up or down some stairs, and there may be a bit of a leak on the way with incontinence, which could make the floor slippery. Home environmental assessment is very important. Risk-taking behaviours such as drug and alcohol use need to be thought about. Lack of exercise, wearing the wrong footwear can all increase the risk of falls. Assess and intervene within your scope of practice and refer on, but talk to your client about falls. What can be done to prevent them, how they can be in charge of the changes that might be needed to keep them living as independently as possible. Think about the environment you're assessing them in. A clinical setting with wide, uncluttered corridors will not be within their comfort zone, or are you assessing them in their own home where they are in familiar territory and in charge? These can have an impact on how your client reacts. Because of the complexity of an assessment, we have asked the busy primary care physician to focus on the 3 Ps: postural hypotension, polypharmacy, and pain affecting mobility. This is the most effective use of their time. This multifactorial assessment checklist for falls is available on the website and is on the second page of the Champlain Fall Prevention Algorithm and may be useful for any healthcare professional to assess a senior's risk for falls. Taking a full history and asking about falls within the past year and near falls, and the reason for the fall. Did they slip on the ice? Did they become dizzy? Did their knee give way? Did they trip over the cat? Do they actually have a cat? Focus on your scope of practice, but if, for example, as a social worker, you notice that in your assessment a senior is taking 4 or more medications and that some of them are meds of concern on the list we'll talk about, they consume alcohol and or cannabis, then a referral to the GP or a pharmacist would be very appropriate. Think outside of the box and see your client as a whole person who needs a whole team. Starting the falls conversation and flagging up issues with client and caregivers and giving them control by using the term, these are things you can do to prevent falls, and suggesting that they watch the seniors education modules on our website might be a good place to start. So now to the 3 Ps, and the first is postural hypotension. Consider further assessment for postural hypotension, either through the nurse practitioner, practice nurse, the nurse on your team, if a client becomes dizzy or unsteady on standing from sitting or sitting from lying down. Also be aware of the potential for an older adult to be dizzy when they first get up, and give them time and some tips to mitigate that. Squeezing their hands and wiggling their toes before they sit from lying or stand up from sitting can help with the circulation. An assessment of taking blood pressure and pulse rate after the person has been lying down for 3 to 5 minutes and then again from 1 to 3 minutes is a good way of measuring it. And you can find more information on www.posturalhypotension.ca. The next P is polypharmacy, pills, medication. Major factor in an older person's risk of falls, so this is definitely something to keep in mind during any assessment. Don't forget to ask about non-prescription drugs as well as herbal remedies, vitamins, over-the-counter drugs such as Tylenol and Advil, and of course alcohol and cannabis consumption. A referral to the patient's pharmacist or back to the GP is key to make sure medication review is done correctly. These side effects can really increase the risk of falls, which is why a review of medications and the medication cocktail that some people are taking is so important. Drowsiness, dizziness, low blood pressure, a Parkinsonian effect, a tremor, ataxia, and vision disturbance. This is a list to keep in mind as red flags during your assessment. You can find this as a PDF on our website, as well as more information about medications and deprescribing, including the Beers list, which can also be found through the ISMP Canada website. The third P, pain affecting mobility. It is very important for the healthcare provider to talk about pain and pain control and using appropriate aids for mobility and activities of daily living. An OT can make functional day-to-day activities easier and can also assess for cognitive concerns. Physiotherapist is the best person to assess gait, balance, strength, and weakness, and to prescribe the right walking aid. It's important that your client does not use great-grandfather's walking stick, as he might have been 6 foot tall and she's only 5'2". There are different aids available for different needs and different shapes and sizes. Another thing to reinforce with your client is that the walking aid will not help if it isn't used, and it can help them stand up straight and walk more normally rather than shuffling or limping along without. This can look more dignified and be less aging, as well as being better for their joints, muscles, and pain. A cane should be held in the hand opposite to the affected leg, and with stairs, the unaffected leg leads going up and the affected leg leads going down. Think of the good go to heaven and the bad go to hell. A physiotherapist will also be able to assess, intervene, and treat strength, balance, and gait and pain issues. Physical activity equals move more and sit less. Physical activity is the activity we do every day. Walking, cleaning, shopping, gardening. It's the most important thing a person can do to reduce their risk of falls. Reinforcing this with your clients is key, as the message needs to come from every member of the team. You need strong muscles and bones to keep fit, strong, flexible, and stable. If you don't use it, you lose it is so true. You need to be active to continue with your daily activities and do the things you enjoy, and it's never too late to become active and get them benefits. This is a good message to tell your patients. 150 minutes of aerobic activity per week is recommended to achieve physical benefits. Moderate to vigorous intensity in bouts of 10 minutes or more. This doesn't mean that it all has to be done at once, but it also doesn't mean that someone can go for a walk for 30 minutes and then sit down for the rest of the day. We do know that the benefits of exercise in the elderly can change their strength. A 12-week high-intensity strength training program in Italy doubled the strength of 90-year-olds, and in 3 months, 65 to 90-year-old can rejuvenate 20 years of lost strength. Exercise is a planned event and can be something the person enjoys. Tai Chi is excellent, dance, yoga, or specific classes. Include strength and balance activities at least twice a week, in addition to the 150 minutes. Strength and balance are especially important for those with poor mobility. There are a couple of online questionnaires a person can complete to make sure that they're okay to join in an exercise session, or that they should see their doctor first. These are available through your public health team and on our website. We've also created a guide to make sure a senior can choose the best exercise class for them when times are normal. Which exercise class is best for me is the name of the document. Before recommending exercise, find out what the older adult and their caregiver think of exercise. Different cultures have different approaches to exercise, and so take time to reframe any negative perceptions, beliefs, and attitudes about exercise. Talk about the benefits. It increases quality of life and social activities, reduces isolation, loneliness, and fear, lessens the severities of falls that result from a fall, improves sleep, helps protect for some diseases such as heart disease, diabetes, and cancer, helps with stress management, can reduce institutionalization, and improves cognition. Encourage people to take advantage of whatever opportunity they can to move. For example, standing up out of your chair during the commercial break in your TV program and taking some good deep breaths is an excellent way of improving the strength in your hips, back, legs, and filling your lungs. This will help digestion and breathing and get you ready for the next period to cheer on your favorite team. This is a useful document on our website to help start the conversation about exercise. People who feel that there are some quick wins that they can do to get more active at their own pace can be more receptive to listening to ideas. It is recommended that seniors review either the PAR-Q Plus or the Get Active questionnaire to determine their ability to participate in an exercise class. They're then encouraged to share any concerns they have with their instructor. These levels are identified with public health and in terms of finding the right class in their area. Level 1 programs are chair-based exercises which can really benefit people with poor mobility and improve their strength and endurance, and maybe allow them to move on to the Level 2. Level 2 classes really focus on improving strength and balance. Stand up and better strength, better balance are examples in the Champlain region. Level 3 classes include most activities available through community programs. This is all available on www.stopfalls.ca. An additional resource is the HeartWise exercise program, which are fitness classes designated as safe and appropriate for those with chronic conditions who may need modifications to a standard exercise program. Instructors have been trained on subjects like dementia, fall prevention, heart disease, lung conditions, etc., as they relate to exercise. Visit their website and go to the Locations tab to find programs near you and your client. This is an excellent page to review and leave with your client. It can be found on the Stopfalls website. It was developed when an EMS service had to visit a client multiple times because she fell without any injury but did not know how to get back up. And you'll see it has two sections, one if you're hurt and one if you're not hurt. 50% of all hospitalizations for seniors following a fall was from a fall at home. Home is an environment that the client is in control of, and so you can have the conversation about the hazards, but they have to be willing to make the changes. The You Can Prevent Falls document is an excellent resource for a senior, their family and caregivers, and is also a great starting point to the discussion about the environment and falls. Inside and outside factors should be discussed with the home environment. Also new environments, considering going to visit their daughter who has children with toys. Sharing this You Can Prevent Falls document with family can help everybody. An OT can provide a very useful assessment of the home, not only in terms of hazards, but also improving functional ability, where grab bars might be useful, maybe some extra lighting at night to the bathroom, having items that are used frequently in easy reach, and some aids or aid to help getting in and out of bed, getting dressed, putting on socks and shoes, etc. This full assessment and advice for the client, family, and the clinical team is extremely useful. A reminder that wearing a lifeline is an excellent idea, as long as it's worn and not hanging on the bedpost or on the top of the fridge. Talk about safety with your patient, and footwear is very important. Slippers are called slippers, as you can slip them on and off and over them. A good supportive shoe will have the following components: good length and width in the toe area that is deep and wide enough to allow for toes to wiggle for circulation, laces or Velcro that can be adjusted for a snug fit, allowing for swelling, thick, thin socks, etc. The back of the shoe is high enough to make sure the foot doesn't slide out of the back, the heel being rounded and wide to give maximum contact with the ground, and the sole should have a good grip but not stick to the carpet. General overall health review. This is very important, and if your client needs help, there are some links to finding a physician, referral to a dietitian for nutrition and bone health, and reinforcing that vision and hearing checkups should be done annually. As we age, our vision changes. We become more sensitive to glare, and we need more light to see at night. People who are 60 need 10 times more light to see at night than teenagers. It takes our eyes longer to adjust as we age to sudden light changes, and it becomes harder to judge distance and depth. We need this depth perception when we're going up and down stairs and curbs. A night light is especially important to recommend to use if your patient has to get up during the night, and it's very cheap to run. The cost to run a 7-watt night light in an 8-hour night is about 10 cents for the full 8 hours. Hearing. Researchers have found that people with hearing loss can be 3 times more at risk of falling. One reason might be that people with hearing loss have less environmental awareness, and they don't notice things happening near to them, such as other people, pets, etc. Dr. Frank Lin from Johns Hopkins says many researchers have also suggest that people with hearing loss need to use more of their mental resources to hear and interpret speech and other sounds. so they have less mental energy left for other tasks such as balancing. Gait and balance are things most people take for granted, but they are actually very cognitively demanding, Dr. Lin says. If hearing loss imposes a cognitive load, there may be fewer cognitive resources to help with maintaining balance and gait, which is interesting. So, assessing older adults for falls is a multifactorial assessment. The Champlain Steering Committee can offer you an algorithm to follow, assessment questions you can use or adapt, and tools and resources you can use to give your clients for self-screening or for choosing exercise classes, for home safety advice, and more. And all of these resources are available on our website. As regulated health professionals working with older adults, you know and understand that there are physiological changes that occur with aging and that you would be assessing for those. And hopefully this module will have helped you assess in that way and also with a specific look to falls. The module from the Toronto Public Health is also a useful resource for your information. So to finish off this module, we have a short quiz. The first question: why do falls matter to the health system? This is looking at stats. Which of these statements are true? 4 out of 5 injury-related hospitalizations were due to falls in older adults. Every 11 seconds in the USA, an older adult is treated in the emergency room for a fall. Every 19 minutes in the USA, an older adult dies from a fall. And in Canada, older adults hospitalized for a fall remained in hospital an average of 10 days longer than those hospitalized for any other cause. So you have a choice of answers, A and B, C and D, or all of the above. And the answer is all of the above. Second question: why do falls matter to older adults? Which of these statements are true? Falls are the root cause of injuries that lead to death in the older adult. Falls are the leading cause of traumatic brain injury. Falls seem to make the older adult feel old. And falls can represent a significant but unrecognized underlying illness. So the answer can be A and B, or all of the above. And the answer is all of the above. Question number 3, why do falls matter to older adults? Are these statements true or false? Falls can cause loss of mobility, independence, dignity, and confidence. Does this affect quality of life, such as reluctance to go outside, decreased strength and balance, and unable to enjoy visits and hobbies? So are these statements true or false? And the answer is true. Screening and assessment. Which of the following are intrinsic risk factors for falls? Medications, orthopedic concerns such as balance and gait, pain, and alcohol and substance abuse. And you have a choice of answers of B and C, A, C, and D, or all of the above. And the answer is B and C, balance and gait and pain. Would you encourage screening an older adult of 75 years who presented to you with fatigue, feeling weak, breathlessness, but no fall? Simple, really, yes or no? And the answer is yes, because you may prevent the next fall from happening. The 6th question, also about screening and assessment. You see a patient who has bruising and some pain around his shoulder. He's reluctant to discuss how this happened. Would you A, ignore the issue and just assess and treat the injury. B, advise him to stay in bed as he is at risk of fracturing a hip and would be admitted to long-term care. C, discuss with him and his family or caregiver, if possible, that many falls can be prevented. D, leave him and or a family member with a staying independent checklist and the You Can Prevent Falls document. Encourage him to read it and fill it out, and alert other team members to continue the conversation. So your choice of answers is A and B, C and D, or all of the above. And the answer is C and D. So thank you. First of all, thank you for everything you do to keep your patients and clients well and safe. Thank you for wanting to know more about falls and what you can do to work with your client and the healthcare team to prevent falls. We hope that you found this useful and that you learned a few tips to use, and that you will go to the stopfalls.ca website for information mentioned in this presentation and a lot of other things that might be of interest. If you have any questions, please email rgpeo@toh.ca and we'll do our best to reply in a timely manner.